Hello, my name is Gary Brown. I'm Communications Director with the Philadelphia Department of Behavioral Health and Intellectual Disability Services. I'm here today with Dr. Jean Wright. Dr. Wright is Senior Advisor and Criminal Justice Coordinator with the department. And Dr. Wright is here today to talk about Mental Health First Aid. Mental Health First Aid is a groundbreaking public education program that helps the public identify, understand, and respond to the signs of behavioral health challenges. So Dr. Wright, tell us, what's the essence of Mental Health First Aid? What is it?
Well, Mental Health First Aid, first and foremost, is a public education initiative. And similar to what we all learned when we were kids at medical first aid with Red Cross, we learned how to put pressure on a wound, we learned how to do the Heimlich maneuver, we learned how to do CPR. It didn't turn any of us into physicians or nurses for that matter. What it is, it's an opportunity to give people some resources that will give them some confidence and competence in assisting those that may be in crisis or non-crisis situations with mental health.
So tell me more about why it's important that we're bringing here to Philadelphia, and what exactly are we trying to accomplish here in this city?
Well, it's important because the city has undergone a lot of stress, as many other cities have, whether it's the financial economic crisis, whether it's just living in urban areas that tend to put a lot of pressure and stress on families. So people react to stress in different ways. In Philadelphia, our mayor and our Department of Behavioral Health Commissioner, Dr. Arthur Evans, have kind of joined together and looking at what are ways that we can support individuals in our communities. And so Mental Health First Aid is something that's simple, it's easy to learn, it's something that does not require a degree or any specialization. It's simply the ability to learn certain aspects of how to comfort, how to support, and if necessary, how to get persons to the individuals they need to get to help. Why Philadelphia? One, this is the first urban area of its size to adopt Mental Health First Aid as a possibility to help the general public.
That's wonderful. So tell me more about the training process.
Okay. Well, they have two aspects of the training process. One is the actual training people to be first aiders. And that involves a 2-day program. Generally, it's a 12-hour program. And it goes through different aspects of depression, anxiety, psychosis, all the way down through eating disorders. And over that time period, a person will get trained, and then after that 2-day period, they will be certified to then assist and support individuals that may be having behavioral health issues. The second aspect of that is becoming an instructor. The instructor process, or train the instructor, is a 5-day process, and that's a little longer. And so you're training people to then train first aiders. And in that process, the individuals learn all the aspects of what is psychosis, what is depression, anxiety, those type of things, how to intervene, and they do that over a 5-day period. The first 2 days are getting the curriculum of what that is, and then the last 3 days is over practice and trying to implement those studies.
That's wonderful. So at the end of the day, I understand this is a 3-year project, isn't it?
Yes, this is a 3-year project. The first part of the project, we trained public safety employees. And so we've already trained a cohort of 30 public safety individuals, and then we're about to launch 2 more training opportunities for 30 people, each training for the general public. And so each year we'll do 1 cohort of public safety, which is 30, and then we'll do 2 more cohorts of the general public, which together will be 60. So 90 people a year will be trained over the next 3 years. Great. And so if you do the math, 90 times 3, that's how many we're going to have at the end of 3 years.
Great, that's wonderful. Anything else you'd like to add about Mental Health First Aid?
Well, I think it's important for the public to know that we recognize that we're all living in stressful conditions, and that what we're really trying to do is give people confidence to be able to intervene, whether it's family, friends, or anyone that they may be having contact. Sometimes people at work have stressors, and we all work 8 hours a day, so we have connections with people at work, and we may notice individuals that are particularly struggling in a particular situation. So this is an opportunity for them to learn how to intervene and how to help.
That's wonderful. Thank you, Dr. Wright.
Thank you, sir.
Really appreciate it. So that concludes our segment on Mental Health First Aid. So stay tuned as we highlight more of the initiatives and the services provided by the Philadelphia Department of Behavioral Health and Intellectual Disability Services and our broad network of providers. Thank you.